During my studies and internships, I learned what we call the disease model, which was conceptualized in the early 80s, and it was a progress. It was brilliant at the time because it called addiction and alcoholism a disease of the brain and body, a genetic illness. So since we know in the field that stopping to use and drink is not a matter of willpower, it helps the patient feel less guilty, more involved in his recovery, like he had a cancer of diabetes, because these two last illnesses, alcoholism and addiction, also are progressive and incurable disease. By incurable, I mean that they are lethal in the addict if the addict or the alcoholic don't stop using or drinking. So the disease model was a great progress, but it's now outdated. And unfortunately, the vast majority of the treatment centers specialized in addiction and alcoholism still just focused on the disease model, and they don't take into account the co-occurring disorders, the mental disorders such as major depression, bipolar, ADHD, anxiety, etc. It's bad in the sense that I saw, for example, soldiers trying to stop drinking in an addiction department in a hospital, left alone with his PTSD. It was not supposed to be the problem. The genetic disease was the only explanation. So we know now that besides being often a genetic disease, the patients are trying to self-medicate psychiatric symptoms by using or drinking. And I do believe in integrated treatment with psychiatry and counseling. And the MN Clinic offers me a great chance to practice that way. Some years ago, the poor addict alcoholic went to a psychiatrist and was told that the MD couldn't do anything for him as long as he was still using or drinking. So the guy crossed the street, went to a substance abuse counselor, who told him that he couldn't do anything for him as long as he was not mentally stabilized. So they were not wrong, but they were not working together. Now we do at the MN Clinic, and we do even better than the few pioneers of integrated treatment, because here Dr. Stoller reads the brain scan of each patient, whether it's major depression, PTSD, or ADHD, can be mimicked in the cerebellum by a vision problem. That's what I learned too. So not only pharmaceutical pill that she prescribes, but she also prescribes a lot of amazing supplements, so you can go natural, and the treatment is tailored. Every patient is unique. So when we decide that X or Y patient of hers can benefit from counseling sessions, I already know about their pathology. I know that he's under such and such treatment for mental health, and I can accompany his progress. So I'm so privileged because very few addiction counselors only have access to the knowledge of some mental health medicine, because the medical profession, and particularly psychiatrists, are still very reluctant to open the door to known MDs. At the MN Clinic, it's just the contrary. So you need to prepare the brain, to repair the brain before talking therapy can work. And very recent studies, by the way, published at the end of 2012, prove that you cannot get good results from a person whose prefrontal cortex is not able to focus, absorb information, and plan for a short or long-term future as a patient in recovery. So I'm myself a fervent Alcoholics Anonymous member, but I think that the message can only be absorbed and respected when the AM member is mentally ready. So I'm myself an addict and an alcoholic in recovery, and the patient said to me, I like this because you can relate, empathize without pity, and give us hope. But again, without Dr. Stoller and the Amen Clinic, scans and diagnosis, it would be very difficult, maybe impossible, to be really helpful on the long term and not only for a couple of weeks before relapse.